it's Dr. Alex Earl. I'm here at Pure Plastic Surgery today, and it's Hump Day with Dr. Alex Earl. All right, so yeah, every Hump Day I get to spend some time with you guys, and we go over some plastic surgery topics. And of course, I can answer all your burning questions, okay? And of course, you know that's great, reliable information. It's coming from a double board-certified plastic surgeon. You know, we can do this. We do this every week, and we also take suggestions. So if there's anything specific you guys want me to talk about, please go ahead and let us know. And the other thing is that we always record these, and then we put them up on YouTube. So if you miss any of the Hump Days, or you want to go back and look at some of the old ones, take notes, things like that, right before your surgery, you can always go to our YouTube channel, which is Pure Plastic Surgery on YouTube, and you can get some great education there. Okay. Today I thought let's talk tummy tucks. Okay, so it's been a while since we talked about tummy tuck, you know, otherwise known as abdominoplasty. And there's quite a few, you know, different, kind of variables there. And I want to talk just a little bit about pretty much everything, the types of tummy tucks, you know, what you need to do for pre-op, what to expect for the operation, post-op, and of course, we always have to talk about the potential for complications as well. So, as you guys know, and I always say, the only way to have 0% complication rate is to not do surgery, right? So I know where patient safety is our #1 priority here at Pure. We do absolutely everything we can to minimize the risk as much as possible, but it is never 0. Unfortunately, we can never get it all down to 0%. Okay? All right, so getting started, there are a few different types of tummy tucks, okay? So there's your mini tummy tuck, your regular or full tummy tuck, your extended tummy tuck, and then there's what's also called the Fleur-de-lis type of tummy tuck, okay? So, of course, I kind of put them in order from like least aggressive to most aggressive, okay? So we can start with the mini tummy tuck. So for the mini tummy tuck, this is definitely the least aggressive one, and it involves basically just a skin excision from below the belly button, okay? So honestly, not a lot of patients qualify for the mini. It's really, you know, that patient who's actually like in very, very good shape. They don't have a lot of muscle separation. They like where their belly button is, and there's not too much excess fat. And really, all they have is a bit of excess skin between the belly button and the suprapubic area. Okay, and so the scar, while it's shorter than the other scars, is not necessarily a short scar in the sense that it is going to be longer than your typical hysterectomy or C-section scar, okay? So it still goes from like about anterior hip to anterior hip. So it's not that short a scar, but of course it can be kept quite low, very easy to hide. And that little annoying, you know, little bit of excess skin can be excised to like really tighten up that lower abdomen there. Now, what it does not involve is release of the belly button. It does not involve muscle repair or plication, okay? So that's why not a lot of people qualify for that mini tummy tuck, okay? Next, of course, is the most common one that we do, which is your what we call your full tummy tuck or regular tummy tuck. And that is quite a bit more involved than the mini, okay? Because that involves, of course, the excision or the removal of the excess skin. It involves releasing the belly button and then creating a new opening for the belly button to come out. It also involves your muscle repair or plication. And of course, it typically comes with liposuction to the flanks and the waist, okay? So this is the most common one because after either, you know, big fluctuations in weight or, you know, pregnancy, one or multiple pregnancies, you are going to have weakness of the abdominal wall. You may have what's called diastasis, which is separation of the muscles, you know, the rectus muscles, which are the ones that are here. So those can get separated or become weak. And for that, you're going to need that plication or muscle repair. Now, can you have weak abdominal wall without a diastasis? And the answer is yes. So you don't necessarily, the muscles don't necessarily have to get separated, okay? They can just become weak from being stretched out so forth. So you see this more commonly with like either multiple pregnancies or pregnancies of multiples. People who have twins, you know, triplets, things like that, where the belly got really, really big, really, really stretched out. The muscle didn't necessarily separate too much, but they didn't really bounce back, and so these patients have that look that when they're on their side and they're just completely relaxed, it looks like they're 4 or 5 months pregnant still, because the muscles are not holding everything in. Okay, so the muscle repair or plication works for that, as well as a true diastasis where the muscles are actually separated from each other. Okay.
Do you recommend the same amount of massages for each type of tummy tuck?
Yeah, so massages are going to talk about that a little bit, and there's going to be, they're different from the massages you get for lipo or BBL, and yeah, they're going to be a little bit more intense for a full tummy tuck as opposed to just your mini tummy tuck, where you really don't even really need massage unless you had a significant amount of associated lipo when we did the mini tummy tuck. Okay.
And speaking about the diastasis, one question on that.
Of course, yeah.
If there's a very small or no diastasis, will Dr. Earl opt to not do a muscle repair during the full tummy tuck?
If there's no diastasis, and because it alludes to what I just talked about, and there's no muscle weakness, then yeah, we can do the tummy tuck without the muscle repair, okay? But like I just said, you don't necessarily need diastasis to have muscle weakness. So the muscles are tight together, but the abdominal wall is weak, then we still should do that muscle repair to tighten it up, so that when you're in a relaxed state, things look pretty flat and they're not kind of still bulging out.
Thank you.
Okay. All right, so the next step is extended tummy tuck. The extended tummy tuck is really very, very similar to the full tummy tuck. The only difference there is how far the incision goes. So in a full tummy tuck, the incision is going to go hip to hip, probably from about here to here. Are you able to see down where my fingers are pointing? Yeah, okay.
Oh, yeah.
From about here to here. And then once you have to kind of turn the corner and start going towards the back, that's what we consider your extended tummy tuck. Sometimes we actually have to prop the patient a little bit on one side, do that, prop the patient a little bit on the other side, do that to kind of finish off the extended tummy tuck. It doesn't go all the way around. That's what we call a circumferential body lift. Some surgeons do that. I actually don't do that procedure. But if you went all the way around, that's what that would be called. But extended does go around the corner and end somewhere here, kind of towards the back. Okay? And then finally, we have the Fleur-de-lis. So the Fleur-de-lis is really done only in massive weight loss patients. Okay, so these are patients that have lost 100 pounds, over 100 pounds, and typically when they do that, and they did it with bariatric surgery, like a gastric sleeve or gastric bypass, that means that they lost the weight very, very quickly. And when you lose the weight that quick, especially something like 100 pounds, your skin does not have a chance to bounce back. It doesn't have a chance to bounce back, and so they have excess skin not only in the vertical direction, but they have excess skin in the horizontal direction as well. And so therefore we do the Fleur-de-lis, where the final scar is not just going across the bottom there, but it has a vertical component to it as well. Fleur-de-lis used to be a lot more common back in the day when you were doing your gastric bypasses open, because the patient already had a scar that went up and down. So you're adding that lower scar, but you weren't adding anything else. They already had that big laparotomy scar. But of course, nowadays, most of your gastric bypasses and gastric sleeves are done laparoscopically, meaning you only have the little tiny kind of stab incisions there for the laparoscopic instruments, and you don't have the big laparotomy scar. So a lot of patients they really don't need it. They're not going to want then all of a sudden to have a big scar that shows, of course, in their swimsuits and things like that. However, like I said, massive weight loss patients, tons of excess skin. Those patients are okay with having the Fleur-de-lis because they don't want, because if we just remove it in this direction, they're still going to have loose skin in this direction. They're just going to feel very floppy still. They're still not going to look great in their clothing. And what these types of patients want is to look great in clothing, and they don't mind the additional scar. Okay?
Is there anything you can do to reduce that scar?
No, unfortunately not. So that scar is going to go from the xiphoid, which is the bottom of your breastbone or sternum here. It's going to go from there all the way down to the pubic area. It's going to be all the way up and down, typically for a Fleur-de-lis type of scar. So the goal for those patients is not to go in a two-piece bikini, okay, but to look great in clothes. That's really the goal there. And you remember, you got to know where you're starting from, right? Not everyone's starting from the same place. But if you were someone that was morbidly obese, you're weighing, 300, 400 pounds, and you lost a ton of weight, The good news, of course, you're now healthier, you're going to live longer, but you have all this excess skin, and this all has to be removed. And those patients typically will get a fleur-de-lis, and they don't mind the scars, and they're extremely happy with the results. Okay. All right, so those are the different types of tummy tuck that we do. Like I said, starting with the full onwards, they're going to require, you're typically going to need that plication and muscle repair. The mini does not do application and muscle repair. Also, from here onwards, you're going to have a scar around the belly button. Okay, so while it's quite easy to get that scar very nice and low, so even if you wear a fairly low cut swimsuit, it's like you can hide it. There's also going to be a little bit of a scar around the belly button, and that's the one that's a little bit tricky sometimes. Because unfortunately, the belly button scar is also the one that has the highest chance of keloid or hypertrophic scarring. So we really have to work hard in trying to minimize that risk. So typically at about 2 weeks post-op, you can start doing a little bit of belly button training. So you can use an actual training area or a marble or cotton ball in there. And then also start using scar cream such as Silogen very, very diligently twice a day around that belly button scar to try to get it to be as nice and smooth and flat as possible to try to prevent it from becoming a hypertrophic or keloid scar, which of course is just a dead giveaway that you had a tummy tuck. So sometimes if we see that it's starting to get raised, one of the things that you can do is get a steroid injection, such as Catalog. So you can get a Catalog injection to prevent it from, getting any larger or more visible. And then, of course, if it does happen, and then we can always do a revision to the belly button. So basically, cut out or excise that hypertrophic scar, cut out or excise that keloid scar, and then just basically do the belly button all over again. Okay. So that's the story with the belly button there. With a mini, you usually don't move the belly button at all. Okay?
Is there a way to avoid the dog ears?
Right. So that's definitely it's not really a complication, but a potential issue with the tummy tuck. So what are dog ears? So dog ears are when there's some excess skin kind of at the end of the incision and it kind of pokes out a bit, and that's why we call them dog ears there. And so the way to try to prevent that is to just bring the scar as far back as you need to try to minimize that risk. That's why sometimes you may go from, like, say, a full tummy tuck to an extended tummy tuck if you need to kind of just continue that incision all the way back and remove a little bit more excess skin around the corner there to minimize the risk of a dog ear. The other thing that you can do, and that's what we typically do, is liposuction to the area. So, and that was actually the next thing we're going to talk about there, because with the tummy tuck, you do get liposuction typically to the flanks and the waist, and we can lipo that dog ear area such that when, as you're healing and you're using your garments and your binder and then your garments, we can try to get that area to sock in. So it's not unusual that at the beginning, say early post-op, that those areas are more prominent. It looks a little bit more like a dog ear, but after about, say 6 months or so, being in your compression and everything else, that those areas really kind of sock down and they're no longer, so visible basically.
So if I get a tummy tuck, but I also want a bigger butt and come back but I don't want to have another surgery and come back for butt injections, are butt injections okay?
Typically no. So if you're asking about butt injections such as silicone and some other things that are done, there's really the only buttock injection that's approved in the US is Sculptra. Okay? And Sculptra is typically not done for like a really large volume change. It gets incredibly expensive. It gets really expensive, and it's more for filling out certain areas, very specific areas, but it's not for like what a BBL would do. So here in the US, typically, if you want a significant change in the volume or shape of the buttock, then the recommendation is to do a BBL or fat transfer. And of course, that I don't do that at the same time as a tummy tuck.
Thank you. Quick question. Can you still get a tummy tuck at age 64?
Well, technically yes, but not here. Okay. So my age limit for this procedure is 55. But of course, those are my preferences. Doesn't mean that's everybody's preferences. There may be, and that's also because we do everything here at Pure in our office-based surgery setting. So you may find a plastic surgeon that works out of a hospital, and does cases in the hospital setting where they may keep you overnight to make sure that you're doing okay. And so in that particular case, then you'd probably be okay having your tummy tuck in that setting. Okay?
Thank you.
So the lipo is to the flanks and the waist, but here in Florida, because this is a question we get all the time, here in Florida we do have a 1 liter or 1,000 cc limit as to how much lipo, how much fat can be removed via liposuction at the time of tummy tuck. And it's actually quite specifically written into the rules for office-based surgery in Florida. So there's a rule that's given to us by the Florida Department of Health. So really no surgeon anywhere in Florida should be taking out more than 1 liter when they're doing a tummy tuck. So, I know there's some surgeons out there that are combining tummy tuck with BBL. I'm not sure how they're doing that, other than either they're going above the limit, or it's like a very, very small BBL where you're just removing 1 liter and then you're putting 500 on each side, and that's all the patient wants or all the patient needs. Okay? But this is definitely the limit here in Florida. And that's typically why we don't combine it with a lot of other regions. And, if you have a small area, say chin, so yeah, chin lipo is not going to contribute much to that volume. So if you want to do a chin lipo at the time of tummy tuck, that would be okay. Arms don't really contribute that much either. So if you want to do arm lipo at the time of tummy tuck, that would probably be okay, depending how much you have in the flanks and the waist. But if you have a ton of fat in the flank and the waist area, then we're not really going to want to add anything else to it because we're going to reach that limit. And sometimes you do have to come back. Because of that limit here in Florida, we can do the tummy tuck, we can remove that 1 liter, but there's going to be some fat left behind, and that can be fat in the flanks and the waist and the anterior abdomen, in the back, whatever. And a lot of patients like to come back after their tummy tuck to do either their Lipo 360 or BBL procedure. Which brings me to another question. We always get asked what's best to do first, tummy tuck or lipo BBL. So in my experience, as I do more and more of these procedures, over 2,000 BBLs, I don't even know how many tummy tucks, I think it is best to do the tummy tuck first. Okay, all things being equal, best to do the tummy tuck first and then come back for your Lipo 360 BBL. Why is that? Because we have the maximum stretch in that skin initially. If you do your Lipo 360 BBL, then there's, we've added now some fibrosis, we've added down some scar tissue. It's a lot harder to stretch that skin down when we're doing a tummy tuck after the Lipo 360 BBL. It's a bit more challenging, and typically we can remove less skin. Okay. Also, if you have a lot of fibrosis and other issues from before, it's difficult to get everything to be completely smooth after a tummy tuck if you're doing it as the second stage. So, in general, I would say that for most patients, I would recommend doing the tummy tuck first and then come back for your Lipo 360 and BBL.
Thank you very much.
So, 2 questions come after that. What is, doc, am I going to have enough fat? The answer is yes, absolutely. Remember, we're limited to how much we can remove.
You're right.
Okay?
Next question.
So are you going to have enough fat? The answer is yes. Do not worry about that. Do not worry about that. We haven't even touched the back. We haven't touched the anterior abdomen. Okay? So yes, you're going to have enough fat for your BBL. So that should not be a concern.
I'm not sure if you would just address this, but this question pertains to what you're speaking of. Besides the fact that you can only get 1 liter of lipo while doing a tummy tuck, what are the other reasons that you will not combine a BBL with the tummy tuck?
So that's of course a very big reason there. You're not going to get enough bang for your buck out of the BBL. And the other one is of course recovery. Recovery becomes very, very tough. Okay, so for a tummy tuck, you should be of course laying on your back and reclined. Okay, because you're going to feel very, very tight here. You're not going to be able to lay flat, so you're going to want to be in either a recliner or if you're in the bed with 2 or 3 pillows behind the back, 1 or 2 underneath your knees. Okay, and then that necessarily kind of is going to put pressure on the buttock, which you shouldn't do if you're having a BBL, right? You should be offloading the buttock and the hips. So then you have to then go into like these funky chairs with cutouts and things like that, and it just becomes a very, very, very difficult type of recovery. Okay, also when you combine that, you have to really, really worry about blood loss, okay, because now you're combining 2 kind of big or major procedures. That's why when you see that people do these procedures in other countries like Colombia or Dominican Republic, it's very, very common for them to then get transfusions afterwards, okay? That's not something we want to do here. Of course, patient safety is our number one priority. It is definitely safer for the patient to separate these procedures, okay? And that's our number one priority here at Pure.
Thank you.
All right, so yes, so do your tummy tuck first. Don't worry about the fat. We are gonna have enough fat for your next round, okay? All right, oh, and the other concern is some people say, well, will my skin get loose again? So you have my tummy tuck first, you're gonna do all this lipo, am I gonna get loose again? And in my years and years of experience and hundreds or thousands of cases, I haven't seen that. I don't recall a single case where I have to go back and then retighten the tummy tuck because we did a lipo or BBL afterwards. Not until now. Of course, it could happen. There's always a possibility, but it's really rare for that to happen. Okay. What are some of your contraindications to tummy tuck? Who are the people that are not candidates? So one of the big ones is visceral fat. You guys know the difference between your subcutaneous or superficial fat and your visceral fat? I'm sure a lot of you do. But the visceral fat is the one that is inside the tummy, basically all mixed up with all your organs, okay? That is the fat that there's no surgical procedure for that, okay? That's the only fat, the only way to reduce that amount of fat with diet, exercise, or weight loss surgery, okay? But you can't directly remove or excise that fat, okay? And so if you have a large amount of visceral fat, you're also not a great candidate for liposuction, obviously, because you can't get to that fat, but you're not a great candidate for a tummy tuck because the belly is still going to look round. So even if you remove that excess skin, even if you tighten the muscles, because you have all that visceral fat in there, your belly's still going to look kind of like a barrel. That's when you see a little bit of these barrel-shaped kind of tummy tucks that come out. The reason for that is that it probably wasn't a great patient for a tummy tuck in the first place. It wasn't a great candidate because they have too much visceral fat. And there's nothing that we can do at time of lipo or tummy tuck to address visceral fat. Okay?
After the tummy tuck, when can you go back to normal activities?
Yeah, so you're going to want to wait at least 6 weeks for doing all your normal activities after your tummy tuck.
Oh, and one follow-up question to that.
Yeah.
It's very important. After tummy tuck, when can you go back to sexual activity?
Also 6 weeks. I know. I just heard a bunch of groaning out there, but no, it's true. So no big physical activity, going back to the gym, no sexual activity for 6 weeks.
Okay.
The other big contraindication to a tummy tuck is smoking. Smoking is huge, okay? You do not want to have any nicotine in your system at the time of the tummy tuck. It can lead to many complications such as infection, wound healing issues, open wounds, skin dying, necrosis, and a lot of just badness overall. So you do not want to be smoking and have nicotine in the system at the time of tummy tuck. And remember, okay, yes, cigarettes are the most common way of having nicotine in your system, but vaping, okay, most vapes have nicotine. Marijuana, if you're rolling it with cigarette type papers, that may have nicotine. Hookah may have nicotine. Hookah is not allowed, okay? We say no smoking 30 days before and after surgery. That includes hookah, okay? And if you're gonna do marijuana, you want to make sure it's not laced with nicotine and the papers don't have nicotine. THC is okay by itself, but THC plus nicotine is a cancellation, okay? Any nicotine in the system, you gotta get canceled.
Perfect. Thank you.
All right.
We do have a few questions.
Yeah.
What color are the stitches that are used? Do they dissolve?
No, I don't think anyone's asked about the color of the stitches. All right, that's a great question. Most of the stitches are clear or white. So the ones that we put in the deeper layer, that's called scarpas, are typically white, and the ones that we put near the skin are clear. Now, there's one very large suture that we do for that muscle repair application. Okay, everyone wants to search up the technical terms called a number 1 looped PDS. It's a double suture. It's very large, very strong, and that one has like a bluish, purplish color to it. In case you were wondering. Okay.
Thank you. What can be done to prevent necrosis?
Well, exactly the most important thing is no smoking.
Yes.
The most important thing that the patient can do is no smoking. The most important thing that the surgeon can do is not be too aggressive with lipo in the central portion at the time of a tummy tuck, okay? So the more aggressive you are with the liposuction, the higher the risk of you're injuring the blood supply, and that can lead to muscle necrosis. So that's why I typically focus the liposuction only to the flank and the waist area, and not this central portion here, because that's like a double insult. That skin, you're already lifting it up, you're separating it from your abdominal wall, you're cutting, you're going through all those little blood vessels there, and then if on top of that you do liposuction, it can lead to potentially an incidence of skin necrosis there. So on the patient side, no smoking, get your diabetes under control. All right. On the surgeon side, don't be too aggressive with your lipo at the time of tummy tuck.
Quick question about the visceral fat. How do you know if it's visceral fat?
Yeah. So
or how can the patient know if they're at home?
One of the kind of a way that you can tell is by literally like pinching yourself. Okay. So if you have your belly sticks out a bit and you pinch yourself, and most of that which is sticking out, you can actually grab between your fingers. That means that it's superficial fat and that we can get to it by either tummy tuck or liposuction. Now, if you're pinching and you can barely grab anything, but your belly's still bulging out, that means that most of that fat is due to visceral fat. In which case, then your options are really diet, exercise, or gastric sleeve or bypass or weight loss surgery.
Thank you.
Of course, for pre-op, we need all your regular labs, your EKG, your medical clearance, and chest X-rays only for those patients that are over 40 years of age or have some sort of history of like a lung condition such as asthma or something like that. Okay. And then so the next thing I want to talk about is hernias, because we asked, can you fix a hernia? So a lot of times we ask, can you fix hernias when you're doing lipo-BBL? And for those procedures, the answer is no. And actually, you want those hernias fixed before you do the lipo-BBL. Remember, those are blind procedures, and potentially if you have a hernia, you can injure an organ, some bowel, and that can be very catastrophic. Okay, so if you have a hernia, you're going for lipo-BBL, get it fixed first. Not necessarily true for a tummy tuck. If you have a belly button hernia or umbilical hernia or a small ventral hernia somewhere along this line, then we can fix it at the time of tummy tuck and just get it all done all at the same time. Okay, now if it's a huge hernia, very large hernia, then no, you got to get that fixed first. But if it's a small ventral hernia or belly button hernia, we can fix it at the time of tummy tuck. Okay? All right. Post-op, we had that question about when we can have sexual activity, when we can get back to all regular activities, the gym and whatnot, and it's going to be 6 weeks. Okay, so in the first 6 weeks, no heavy lifting, no strenuous activity. You don't want no swimming or submerging the body underwater. So only shower, which starts 48 hours after surgery. No bathtub, no jacuzzi, pool, beach, or anything like that in the first 6 weeks. Okay. At the beginning, you're going to walk hunched over like this. You're going to be sleeping in the recliner because everything feels very, very tight, okay? You'll start to straighten out somewhere around 10 to 14 days, okay?
Thank you. Quick question, probably a little off. Do you require vaccinations prior to surgery?
No, not vaccinations, but we still requiring your COVID PCR test, okay? Because of everything that's going on, because of the Delta variant, and the unfortunate fact that we're still not over COVID, everyone needs a PCR test within 5 days of surgery to make sure that you're COVID-free at the time of the operation.
Thank you.
Okay. Garments. Okay, so we start off with abdominal binder. Just kind of this little white thing wraps around you. You're going to use that while the drains are in place. Once we remove both drains, then you can switch to your faja type garments. Okay, so I mentioned drains, so let's just talk about that a little bit. You get 2 drains. I don't do drainless tummy tucks. Some surgeons out there do. I do use drains. There's 2 of them. They come out at either end of the incision. They can be in anywhere between 1 to 3 weeks depending on the patient. It really all depends on how much fluid is coming out. Once it's less than 25 cc's in a full 24-hour period, it means that drain is ready to come out. For smaller patients, it tends to be closer to 1 week. For larger patients, sometimes it's closer to the 2 weeks or so. Rarely do patients really get to 3 weeks. Once you get to 3 weeks, though, they're still putting out a lot. I typically remove them anyway because at that point in time, they've been in so long that the chance of infection starts to go up. So I usually almost never leave them longer than 3 weeks. Okay?
Yes, sir.
All right. So those are your drains. Okay, so I'm sure the next question is going to be, why don't you do drainless tummy tucks? Okay. So I don't like to do drainless tummy tucks for a couple of reasons. So it's the decision point is not whether, it's not simply whether I put a drain in or not. It's a different technique. So in order to do a drainless tummy tuck, you have to put in what are called quilting sutures. These are stitches where you're attaching the skin that you lifted up and then pulled down. You're attaching that back down to your muscle or abdominal wall. Typically, these stitches need to be permanent sutures, which means that they never go away completely. Okay, and you have to be placing them very, very specifically in a way that they don't cause indentations and contour abnormalities. Okay, so I don't like to use them for those reasons. So number one, potentially you can have an indentation or contour abnormality. Number two, because the stitches are permanent, sometimes you can get late infections. Like I'm talking like years down the line, 1, 2, 3, 5 years down the line. Unfortunately, potentially that little permanent suture can get infected. And then of course, from my point of view, it takes a lot more time to do that. And I want to get patients in and out of the OR as efficiently as possible for their safety. The less time that you're under general anesthesia, the better it is for you. Okay?
Thank you.
So those are all the reasons why I don't do the drainless tummy tuck.
So
Okay?
even with the drains, you still recommend massages after tummy tuck?
Yeah.
Do they do the massages with the drains in?
Awesome. Great segue to my next point here. So, so massages. There's a little bit of confusion out there with the massage because a lot of people think that it's the same as massages as you would get with Lipo 360 or Lipo 360 BBL. And it's not. It is different, okay? So the massages that you get for a tummy tuck are not the same as the ones you would get for Lipo 360 and BBL, okay? So with the tummy tuck, you can start massage early as well. You can start, next day or 1 or 2 days post-op. But those initial massages are going to be only to the areas where there was lipo, so typically the flanks and the waist. And then, believe it or not, to the lower back, even though nothing was done there surgically, okay? Why is that? Because of the fact that you have to be hunched over all the time and that you're sleeping in the recliner all the time, you start to get some soreness and sometimes even some spasms of the muscles of the lower back. And so the massages help relieve that, okay? But what you don't want to get is massages, especially aggressive massages in the anterior abdomen too early. You don't want to get those in the initial post-op days because you have that skin that's trying to heal and you have the large incision that's trying to heal, so you don't want to be manipulating that area. Okay?
So how many massages total would you say your average tummy tuck patient?
Average tummy tuck probably get about 10 total.
Thank you.
And you get the first few, like I said, mostly the flanks and the waist and the lower back, usually about the first 5 or so. And then once you get to 2 weeks post-op, by that point in time, you've had sufficient healing in your incisions that you can then start to get some lymphatic massage to the anterior abdomen. You may or may not have your drains at that point, hopefully not by 2 weeks post-op, and so then it also makes more sense to get your lymphatic massages at that time. Okay, so it's not like Lipo BBL. You start off just in the flanks and the waist and the lower back. At 2 weeks post-op, that's when you can start getting some more of the lymphatic type massages, including the anterior abdomen. Okay, all right, and then last but not least, we got to talk about complications. Okay, so like I said at the very beginning, the only way to have a 0% complication rate is to not do surgery, okay? So even at Pure, where we have a very, very low complication rate and we try to do everything absolutely possible to maintain patient safety at all times, of course things can and do happen, and that's just part of the deal basically if you're having surgery. So what are the potential complications, okay? So one of them, of course, is bleeding. Typically, there's not a lot of blood loss in the tummy tuck. It's actually very, very minimal. It's all open and under direct vision, so we can control the little blood vessels as we see them. It's different from, say, Lipo BBL, where it's all blind procedure there. Okay, so for the most part, very minimal blood loss. But is there potential for bleeding or hemorrhage afterwards? There is it's a possibility. It's quite low. I would say less than 1%. But it is possible there. The first thing you probably notice is blood, like like frank kind of blood going into the drains and filling up very quickly. And that's probably one of the things that you would see, and then you would have to be concerned. You definitely want to call your surgeon, show him what's coming out of the drain, measure what's coming out of the drain so you can tell him kind of what amount of volume is coming out if you start to see that. And then of course if you start to feel lightheaded, heart rate goes up, blood pressure comes down, you probably want to go to the ER at that point for potential bleeding or hemorrhage. Okay, but like I said, very, very rare, less than 1%. The next is, of course, wounds. Okay, we are putting this incision under tension. Okay, because we want to get things as tight as possible, and therefore, there are potential for areas that open up. Also, if you get like a small infection in a certain area, we may need to open that area up to drain it. Usually, it would be very rare that the whole thing opens up. Extremely rare. But yeah, you can have small areas that open up, and typically we just treat those with dressing changes. Sometimes if it's a little bit larger, you may need something called a wound vac to help close the wound, okay? But eventually everything will close and seal up, and then you'll see how the scar looks. You may or may not need a scar revision afterwards, okay? So that's wounds there. Infection, of course, you always want to try to prevent that. Okay, this is going to be a good question. Let's see if we get some answers here, okay? What do you guys think is the #1 cause for infection after a tummy tuck? Just throw a couple answers there, a couple wild guesses.
Sleeping?
No.
Smoking?
Which is the #1 cause? Smoking can definitely increase it, but what's the #1 culprit in infection after a tummy tuck? This is going to be a public service announcement right here. All right, we'll see if there's one more guess, and then we'll go.
I got sleeping on your stomach, but I think
you definitely don't want to do that, and you can't really.
Not bathing?
Yeah.
Not washing the area?
Yeah, not washing the area. Okay. The #1 culprit for infection after a tummy tuck is your belly button. Clean your belly buttons, people. All right, you guys do not know what type of stuff we find inside belly buttons. Okay, very nasty crud. I mean, I gotta, like, sometimes I feel like I find like almost like rocks or like little diamonds in there. But no, in all seriousness, the #1 reason for an infection in tummy tuck is belly buttons. Okay, and we try to scrub them like very hard here. So typically the first thing that happens is that our circulators shall put like a pool of iodine into your belly button, and then I grab a Q-tip and I really get in there and I really try to clean it out, and then then we put more iodine on it. But we have found belly buttons that are very, very nasty. They have like creamy type substance in there. It's just like people, for whatever reason, don't really get in there when they shower and really try to clean that out. So please, if you're having your tummy tuck, before you come here to have your tummy tuck, clean that belly button. Make sure there's nothing in there. No little rocks, no crud, nothing. Okay? That's the #1 reason for infection after a tummy tuck. Okay?
It's a great tip. Thank you.
Right.
I know we're running out of time.
Yeah, and so let me just finish up here real quick. So the other potential complications are skin necrosis, and we touched upon that. So no smoking for you. Control your diabetes. Okay, and for the surgeon, not too aggressive with your lipo there. And then, of course, the big one that we have to discuss, and so I really do want to talk about this one, is the potential for blood clots. Okay, so blood clots will typically start in the legs. Those are called DVTs, or deep vein thrombosis, which can then travel to the lungs, and that's called a pulmonary embolus. Okay, and this can be very, very serious. So we do want to minimize that risk, although once again, minimize is a key word. We can never make it zero. But we do want to minimize that risk, and so what we do here is we give you a device called the Circulate, which is a sequential compression device which keeps the circulation in the legs going, okay? And you're going to use that anytime you're sleeping or not being very active, so you're just watching TV, lounging, things like that. You're going to have that device, and you're going to use it for all travel. Extremely important, okay? You're going to use it for all travel, especially air travel, okay? And you use that device for at least 2 weeks, okay? No less than 2 weeks. You got to use it for 2 weeks or more. You can always use it more. There's no downside to it, okay? It can only protect you. And then on top of that, you have to do your walking. Extremely important. You want to be up and walking at least 10 minutes every hour while awake. That is the minimum. You can of course walk more than that. There's no limits to how much you can walk. Okay? Do your walking, wear your circulate device. I don't use Lovenox. There are surgeons out there that do. There are several studies that have shown that a sequential compression device such as the Circulate is just as effective as Lovenox, but of course it doesn't have the side effect of potential bleeding. So Lovenox of course can increase your bleeding risk. Okay? So here at Pure we're going to use your Circulate device, and of course the patient's responsible to move around and do their walking.
Thank you very much.
All right, everybody. Well, I think that was very comprehensive. So pretty much all the information you're ever going to need regarding tummy tuck there. Thank you everyone for your questions. They were great. Please don't forget to clean your belly buttons, okay? And I will see everybody next week on Hump Day with Dr. Alex Earl. Ciao.